This weekend, as the millions of Americans who sign up for health insurance through the Affordable Care Act begin to enroll, they will see the largest increase in costs since this law went into effect over a decade ago. Without those so-called enhanced subsidies or tax credits put in place during the pandemic in 2021 and set to expire at the end of this year, some Americans could see their monthly premiums double or even triple next year. That's on top of insurers raising those premiums an estimated nearly 30% in states that use the healthcare.gov website, according to health research group KFF. That same group also says people will pay 114% more on average in their premiums. Let's bring in Dr. Christopher Ford, a Wisconsin-based emergency room doctor and a member of the Committee to Protect Healthcare. Dr. Ford, thanks for taking the time. I mean, there are so many changes for those, especially who rely on the Affordable Care Act marketplaces. If these tax credits go away, look at this. People who earn less than $20,000 a year, who currently pay no premiums, will now be required to pay $66 a month. Those earning up to $35,000 a year will see a premium jump from $86 to $218 a month. And people 60 and older will pay $920 more a month, raising their monthly premiums to $1,380. If the cost of health care goes up that significantly just for insurance, what is the trickle-down effect?
Thanks, Anna. You know, when Medicaid coverage is stripped away like this, or when you put it out of reach for my patients, I don't know many patients that I see that have that extra $1,000 sitting around, right? They won't stop getting sick. Patients are going to continue to get sick, and they will lose the ability to be seen early. They'll show up to the ER when it's too late. Here in the state of Wisconsin, over the last year, we saw about 1.9 million statewide ER visits, and that's an increase of about 4% over the last year. And, you know, of that, we're seeing uncompensated care, meaning patients that don't have the out-of-pocket money to pay for that visit, the increase of about $1.4 billion statewide. Now, these numbers translate into real consequences. We're seeing more patients in the hallways. That means longer door-to-doc times. You're going to have exhausted nurses, exhausted techs, exhausted doctors that are trying to do more with less as the safety net begins to crumble.
I mean, as we pointed out, there are a lot of factors. Age, your income, location is also a factor. In your state of Wisconsin, there are over 300,000 enrolled in the healthcare through the Affordable Care Act marketplace. Most of them are receiving a tax credit and will see some kind of increase. Just to hammer this home, what's that going to look like? What is that going to mean for what you see in the emergency room every day?
Well, as an emergency physician here in the state of Wisconsin, I not only treat illnesses, but I treat the consequences of unaffordable health care. And that means when people lose this coverage, the ER becomes their doctor's office. It becomes their pharmacy. It becomes the safety net all rolled into one. I've seen families who are going to have to choose between insulin and rent. They're going to have to choose which of their family members are going to afford to be able to eat that day, right? And so, like you said, when you have over 300,000 Wisconsinites that are going to be removed from Medicaid in just over a year, you're going to see hospitals close. That means that people are going to have to travel farther. We have 3 hospitals here in the state of Wisconsin that are threatened to be closed because of these cuts. That means people are going to have to travel, hours at a time with heart attacks, with, sepsis, with conditions that need to be treated in minutes, right? When minutes and seconds count, this is going to be the difference between life and death for a lot of my patients.
That is chilling. And we are now here in the 31st day of a government shutdown. Of course, Democrats are talking about healthcare as the reason that they are holding out. Do you have confidence that lawmakers can come to some kind of agreement so what you just described doesn't happen?
Yeah, so, we are seeing right now a lot of people who are pushing against this, right? We're seeing a lot of folks, who are typically conservative. Marjorie Taylor Greene, one, for instance, who's pushing against Speaker Mike Johnson right now, because as she put in her words, there is no off-ramp right now from the ACA, right? There is no plan in place. And Anna, as you may remember, there's concepts of a plan in place, right? My patients can't use concepts of a plan in order to pay for their medications, in order to get access to their primary care doctors, in order to prevent them from coming to my emergency department in dire straits when that could have been prevented to begin with. So it's prudent on all of us, our elected officials, to hold them accountable, for all of us in healthcare to continue to speak out against these cuts, because it's not fiscal responsibility. This is fiscal cruelty on the backs of our patients.
You talk about fiscal responsibility, and that is one of the roadblocks in reaching some kind of an agreement here, because it's billions of dollars the government is having to pay into providing these healthcare subsidies for the Obamacare marketplace. But what do you think could bring down healthcare costs?
At this point in time, what we are seeing right now is, a lot of the additions to the Affordable Care Act that were done with the Inflation Reduction Act, right? These were measures that were put in place in order to make medications affordable, in order to, offset some of those costs onto hospitals, onto providers, things of that nature. And so right now, what we're looking for is we're looking to maintain that fund. We're looking to maintain that ability for my patients to be able to afford their medications in order to prevent these tragedies from happening. At every level right now, we're calling on people to protect Medicaid funding. We're looking to protect these ACA subsidies and invest in that safety net that keeps our ERs open and keeps our neighborhoods alive.
Dr. Christopher Ford, we appreciate your time and your insights and perspective on this issue. Thanks for sharing it with us.
Thanks, Al.